Can AI help us understand the brain? Our team at Cambridge University has developed tools using AI to predict dementia early and precisely. We found that artificial intelligence algorithms that we built and we validate on thousands and thousands of data is 3 times more precise in making this prediction than the current standard of care. Whether a patient will remain stable or whether they will move on and progress to dementia. And this is really important because at the very early stages, when people have the first symptoms or even before symptoms appear, we know that we have up to 30% misdiagnosis. These symptoms might be because of dementia, but they could be also because of depression or anxiety or cardiovascular disease. And by detecting early dementia, we can give the new treatments to patients when they will really make a difference. That means early, before damage to the brain has settled and it's very hard to repair. We currently know from research that changes in lifestyle can make a big difference. About 40% of dementias could be substantially slowed down and avoided if we change lifestyle factors. So we give these algorithms, these computer programs, scores from different cognitive scales, and we give them MRI scans from diverse individuals. We allow them to learn patterns, and the models learn patterns across all of this data and associate them with clinical diagnosis. So once the models have learned these patterns through thousands and thousands of data, thanks to patients releasing their data for research, then we test them with new individuals. We have new patients or new individuals volunteering for research. We take an MRI scan from them and a couple of cognitive scales, and now we can test the models with these new data and ask how well they can generalize their predictions on data that they have never seen before. And we test the validity of these predictions with follow-up data. So we take data from the first visit of a patient in a memory clinic. We ask the algorithm to make a prediction, and then we look at follow-up data, follow-up scans, follow-up cognitive scores, and we test whether the algorithms were right or wrong. And this is really one of the main findings of our work, that we provide now this long-term clinical validation, which is really important for clinicians to trust these tools. If the clinicians can understand how the models make their decisions, their predictions about patients, and that these predictions are validated by follow-up data, clinical data, then they'll be able to trust them more and take them into account when they are making their decisions about new patients that come to their clinic.